that we could see them, and I'm going to introduce them to acknowledge them, starting from our representative, Ni Ojolape, who is UNFPA representative in Ghana. Sir, you are most welcome.
Good morning. Thank you very much, Madam.
We have Dr. Letitia, who is the executive director. Do we have Dr. Letitia? I don't see.
She's there. She's there.
Okay.
Dr. Letitia is online, yes.
Okay. Dr. Letitia is the executive director of the National Population Council, and she's the highest statute in Ghana, of course. She's the highest statutory body set up by the Constitution and which advises the government on population and related issues. She worked in various capacities in health sector in Ghana, and also she's a member of Ghana AIDS Commission boards and an experts panel member of the ECOWAS 2050 Vision Structural Analysis. She holds a master's degree and PhD in public health from the University of Ghana and a medical doctorate from the Donetsk Medical School in Ukraine. Dr. Letitia Yaquara. We can't see if she can put a video onto for the followers and the viewers. That will be appreciated. But our next presenter or our next speaking person will be Dr. Kojo Sim. You'll excuse my pronunciation of the name. I'm probably mispronouncing it, but bear with me. Dr. Kojo is a development economist, a planner by profession. He's a public-private partnership expert and has undertaken advisory and consultancy assignments for key development organizations. And prior to taking up his current position, he was a senior technical advisor to the Ministry of Planning in Ghana from 2017, a senior policy advisor for UNDP in New York, and responsible for local development and urbanization portfolio, where he initiated several economic developments and investment programs in post-conflict and recovery countries. He had before spent 5 years working as the deputy head of Office of the Eastern and Southern Africa for UN Capital Development Fund, facilitating private sector funding for public infrastructure and local economic development in Africa. Dr. Kojo holds a master's degree in public administration from the University of Ghana and a doctorate in the development economics and public finance management from the University of Dortmund in Germany. Dr. Kojo Yaquara.
Thank you very, very much. Unfortunately, I am not Dr. Kojo Mensah Abrampa. Unfortunately, he has been called by the Vice President office at the last minute and could not join us and asked me to step in, apologize on his behalf and deliver his address. My name is Kwame Ewua. I am the Director in charge of Development Planning and Coordination. Thank you very much.
Thank you very much, Kwame, and pleased to see that you are stepping in for him to represent the Ghana and giving the speaking role.
Thank you.
You are most welcome.
Thank you very
much. We have four special presenters who will be sharing with us their experiences from the various countries. Starting from Ghana, we have Dr. Ya Asante, who is the Family Planning Program Manager, Family Health Division, Ghana Health Service. Dr. Ya Asante Yaquara.
Thank you, Madam.
Next one will be, if you can kindly share your video as well for us to put the name on the face as well, it will be appreciated. Our next panelist or presenter who will be sharing experience from Kenya is Mr. Peter Yaquara. Mr. Peter Yaquara is the Director of Technical Services at the National Council for Population and Development with over 25 years experience in population and development sector. He has held various positions in population sector with 12 of these years in leadership and management position, where he has been responsible for managing and guiding all the council's technical activities and maintaining collaboration with partners, ministries, NGOs, CSOs in population programs. He is a policy analyst with expertise in population policy formulation, program coordination, integration of population variable into development planning process, and research and advocacy. Mr. Peter Yaquara, karibu sana. Mr. Peter, do you have you online, please? Mr. Peter, can you hear us? Maybe has not yet joined, but we'll move on with the other one and will be joining us hopefully during the course of the meeting. We have also Gambia who will be presenting, sharing experience. We have Mr. Jibril Jaju, who works for the Ministry of Health in Gambia as the Director of Planning and Information. He's also the coordinator of Health System Strengthening, the FP 2020 focal person, and also Chief Advisor on Universal Health Coverage to Permanent Secretary in the Ministry of Health. You are most welcome, Mr. Jibril, if you're online with us. Mr. Jibril, can you hear us? Gambia. Looks like our panelists have not yet joined. So our fourth presenter is from Benin, Dr. D. Gaston Aunu, who is a public health doctor, epidemiologist. He is also a specialist in the quality of care and management of reproductive health services. And he held several positions at the 3 levels of Benin's health pyramid, namely Chief Medical Officer of Commune, then Reproductive Health Family Planning Support Doctor on various projects of UNFPA and the government of Benin from 1998 to 2005 at the peripheral and intermediate level. He then had the Department of Family Health in a department direction of health for 5 years. And since 2009 has been head of family planning and adolescent and youth health departments at the Mother and Child Directorates. Dr. Gaston, bienvenue si vous êtes en ligne. Dr. Gaston, vous êtes là? Are you online?
Oui, je suis là.
Vous êtes la bienvenue. Si vous pouvez mettre votre vidéo pour qu'on puisse vous voir aussi, ça serait gentil. Merci beaucoup. As I was saying, we are also live on our YouTube channel and you can follow us on UNFPA Ghana. So without further ado, I would like to welcome Mr. Ni Ojolape to give us the opening statements. Mr. Ojolape, you have the floor. Thank you.
Good morning, everybody. Let me first start by saying thank you to everyone that that is participating in this auspicious event. And my job is a very, very simple one, is to first welcome you all and just mention 1 or 2 things, the raison d'etre for this very important interaction. It's against the background of the Nairobi Summit, which took place late in 2019, during which the entire world congregated to provide their support and to re-energize the commitment that has been made in ICPD in Cairo more than 25 years ago. And for in these particular circumstances, what we did was what the world did was that in Nairobi they recommitted to what had already been agreed on in Cairo during the ICPD conference by way of what we call the Program of Action of ICPD in 1994. So this is our attempt from us in UNFPA Ghana. This is our attempt to come together to say, okay, in Ghana we also want to go on what we have committed to, but in particular, we have the issue of family planning, and we felt that it is good for us to look around and see with our colleagues in other countries what are they doing, what are the lessons that we can learn, and we do peer review so that it can re-energize us more in order to go forward as we go into another year, especially on the issues of family planning, given the fact that family planning, FP 2020, this is the year of FP 2020. So I want to thank you very much. I want to thank those who have agreed to be our panelists, who are going to be speaking and going to be sharing experiences from other countries, and for us in Ghana to look at how we can leverage on this to make our own response to family planning better. As we know, family planning saves lives. Family planning is also an exercise of human rights by all of those that are involved. So without much ado, I just want to say once more, we're very, very grateful that you have joined us. We welcome you. I will say, please, Aiko, for attending. Thank you very much. Have a good one. Thank you, Madam Chair, or Madam Moderator.
Thank you so much. Thank you. Family planning saved lives. The Nairobi commitment a year ago. How did it look? Can we have a picture of how it was really looking? Let's see what was happening in Nairobi. What are the highlights in the Nairobi? Yes, please, Mr. Adare, if you can kindly let us remember what happened in Nairobi and what are the commitments, what people marched for. Let's hear it. Thank you.
This November, I'm headed to the Nairobi Summit. That meeting will mark the 25th anniversary of the International Conference on Population and Development. It took place in Cairo 25 years ago. We all know that this promise is waiting to be truly fulfilled. This year, we've decided to come together to talk about this unfinished business. So when I head to Nairobi, I march for rights and choices for everyone. I march for a world that is free of gender-based violence and where women are respected in full equality. I march for the over 800 women who die every day from complications of pregnancy and childbirth. And many of these women are girls. I march for everyone to have that basic right to decide whether, when, and with whom they wish to have children or not. For the people and for the planet, the Nairobi Summit will be a moment to reaffirm rights and choices for all. This is why I march.
Thank you very much. This is Dr. Natalia Kanem, UNFPA Executive Director in Nairobi, marching for the unfinished business of the ICPD. We come a long way from the Cairo in 1994. 25 years later, we still need to accelerate, and this is the year of action, and we need to accelerate. On this note, I would like to call upon Dr. Letitia Appiah to give us her opening statements. Madam, you are most welcome.
Yes, good morning, everyone, and thank you, Agnes, for having me. I was on when you were introducing me, but unfortunately, the IT would not allow me to say anything. So I listened to everything that you said. I'm very happy to be part of this all-important program organized by NDPC, UNFPA, Ghana Health Service, MPC, and all the partners. And I must also welcome all our international partners to this. I think family planning is so collective that it would be very naive for one group or one sect to think that we can do it all on our own. And of course, with the vision of the National Population Council as improved and sustained quality of life for all through effective population management, we recognize family planning as central to our mandate. The policy aspects, access and funding, all three aspects are very critical to our mandate and in making sure that we live our mandate. It is also an undeniable fact that no country has developed socially and economically without according family planning its pivotal position in national development. And that is why the call, the Nairobi call, it's timely, if not, probably it was late in coming, but it is still timely. Family planning does not only prevent unintended and high-risk pregnancies, it actually ensures that every pregnancy is planned and wanted, and every delivery is safe, and makes it easier for every young person's potential to be fully harnessed. The role of family planning in national development, whilst preparing for this, to me, is akin to the role of yeast in bread making. It serves as the leveling agent in the essential process of fermentation. Family planning in preventing unintended and mistimed pregnancies today ensures better skill development and subsequent employment tomorrow. I think we should really begin to look at the link from birth to death, the role family planning plays in our lives. It has a very big role in skill development and in employment. If we really want to solve unemployment tomorrow, then family planning, education, and services should be integral to our national development planning process. Therefore, family planning is not only a health issue, it is an economic, and as Dr. Kanden rightly said, it is an equity, it is a peace and security intervention. It does not just solve health problems, but it solves equity, inequality, empowerment, and security, and most importantly, peace intervention. Stakeholders should therefore view our work as very collaborative. And the collaboration is important. We have to work collaboratively. Family planning ensures inclusivity, equity, resilience, and healthy life expectancy. Most of the time we talk about life expectancy, but healthy life expectancy should really be the focus and the target, because that is what sustainable development hinges on. To this end, Ghana's commitment to reduce to 6% unmet need for family planning by the year 2030 and to reduce maternal mortality rate to 70 per 100,000 live births means that family planning should be a policy budgetary priority for decision-making, policy implementers, and of course, policy takers. We have had many supportive frameworks for contraceptives. We talk about the Agenda 2063, the Africa We Want, the Africa Union Roadmap on Harnessing the Demographic Dividend, that was in 2016, the Maputo Protocol, we have 2014 Addis Ababa Declaration on Population and Development, and then lately we have ICPD 25 Nairobi Statement on Accelerating the Promise. There is a lot of evidence around the benefits of contraception, including not just mistimed and short-spaced pregnancies and induced abortions. Also, it enables us to have fewer maternal deaths. Hence, it should attract the attention of all stakeholders. Honorable moderator, yesterday I had the singular privilege to be a panelist on a platform for parliamentarians from over 100 countries globally during the launch of the Global Contraceptive Atlas Africa region, with a brilliant, thought-provoking keynote address given by Dr. Julita Onabanjo, UNFPA Regional Director, East and Southern Africa. The document sought to assess policy commitments to improve access to contraception and financing for contraceptives. The document sought to draw attention of political decision makers, media, and the public to the performance of the enabling environment vis-a-vis the reality on the ground. The research revealed that unmet need for family planning was similar across countries in Africa, irrespective of whether the enabling environment was conducive or not, highlighting the fact that we need to work some more. Contraception gives women increased agency over their family planning decisions of when and when to have a child from an informed position, choices from an informed position. Investing in family planning not only benefits individuals or families, but also nations and communities. It ensures a healthy population. I think that is where we really need to hammer. That family planning ensures a healthy population. It opens up the window of opportunity for countries to harness the demographic dividend. It helps economies thrive when children survive into adulthood. And then also, it increases the average lifespan. And huge savings are made. And that huge savings can go into improvement in investments in people to help them thrive across the life cycle, education, and job opportunities. For this reason, I hope and pray that family planning will be prioritized, not just in words, but in deeds and in actions, and the budgetary policy priority, budgetary allocation by decision makers and by policy implementers. And then we can also get the policy takers, that is the general public, to understand that family planning is not a controlling intervention. Family planning is an empowerment, equity, peace, inclusive intervention. So thank you so much for having me. And these are my comments for now. Thank you, Doctor.
Thank you very much, Dr. Letitia, for those powerful words and of wisdom. Indeed, family planning is not controlling, but rather contributing to the development. And I liked the fact that you mentioned that you need to look at it, the role of family planning from birth to death. So it's part and parcel of our development process, and we need not to leave it aside. Thank you very much. Let me at this juncture welcome Mr. Nkwama, who will be giving us the purpose of this workshop on behalf of the Director General, Dr. Kojo. Mr. Nkwama, you are most welcome.
Thank you. Thank you very, very much. Once again, I extend the Director General's apology for not being here in person to welcome you. But this is what his address is. It is with great pleasure that I welcome you all to this Family Planning Week E workshop. I would like to thank you for responding to our invitation to be part of this workshop. This year's commemoration of the World Contraception Day and Family Planning Week is even more special because we have colleagues from Kenya, Benin, and the Gambia with us. We met in Nairobi in 2019, where we reaffirmed our commitments to advance population and development in our various countries. In accordance with the International Conference of Population and Development's Program of Action, the need for partnerships and collaboration in addressing population and development issues was emphasized in the Plan of Action and reiterated at the Nairobi Summit. Indeed, countries have a lot to learn from each other. Distinguished resource persons and participants from Kenya, Benin, and the Gambia, we are most grateful that you accepted our call to be part of today's workshop. Population is a development issue, proper management of which yields great dividends. In 1994, Ghana was among 179 United Nations member states who took part in the International Conference on Population and Development to negotiate the adoption of a program of action on population and development, which endorsed a new strategy emphasizing the numerous linkages between population and development. This was with a special emphasis or special focus on empowering women with choice through expanded access to education, health information and services, skills development, and employment creation. Ghana was also part of the global ICPD Beyond 2014 review process, whose report was endorsed by African heads of state at the 2014 African Union Summit, where in the 2014 African Union Summit, where the Addis Ababa Declaration on Population and Development was adopted. The declaration contained 88 commitments grouped around 7 pillars, namely dignity and education, dignity and equality, health, place and mobility, governance, data and statistics, international cooperation, and implementation. The National Development Planning Commission coordinates national development policy formulation, planning, implementation, and monitoring and evaluation of Ghana's development, including integration of regional, continental, and global commitments such as the AU's Agenda 2063 and the Sustainable Development Goals into our planning processes. Ghana's youthful population, like most African countries, currently presents it with a unique opportunity to achieve substantial socioeconomic transformation through harnessing the demographic dividend. Ghana has therefore integrated harnessing the demographic dividend as a key national development objective in the Coordinated Program of Economic and Social Development Policy, which is Ghana's current blueprint for development and currently being operationalized by the Medium-Term Development Policy Framework for 2018 and 2021. And it is also called the Agenda for Jobs. Strategies for achieving the dividend include inclusive economic development and employment creation, education, health and reproductive health, family planning, youth empowerment, and governance. Our annual progress report, which tracks key national indicators, presents us with a unique opportunity to closely monitor relevant indicators for harnessing the demographic dividend, including family planning indicators, and promote dialogue around our progress, challenges, and the way forward. Ghana has committed to the implementation of the ICPD promise of universal access to sexual and reproductive health services, as affirmed by the SDGs. We have also committed to ensuring that the fundamental rights of all individuals are upheld, respected, protected, and fulfilled as set forth in the United Nations Declaration on Human Rights, the African Charter on Human Rights, and the Constitution of Ghana. We will continue to conduct periodic monitoring of the implementation of the AADPD or ICPD. To help implement our commitments, a policy framework has been developed for Ghana with objectives, strategies, indicators, and targets. A cross-sectorial planning group on population and development has been earmarked to review the policy framework, which will subsequently be incorporated into the next medium-term national development policy framework, which is 2022 to 2025. The preparation of this has started in earnest. The focus on family planning is to improve population management by providing sufficient resources for the provision of reproductive health commodities, improving maternal and adolescent reproductive health, strengthening the integration of family planning and nutrition education in adolescent reproductive health care, providing access to the full range of sexual and reproductive health information and services, among others. As we seek to promote family planning, we are reminded to pause, take stock, and reflect on the progress so far, the challenges and lessons learned also to shape the way forward. We are hopeful that today's discussions will help each of the countries present to do just this. The COVID-19 pandemic, which has necessitated that we commemorate this day virtually, has indeed highlighted various weaknesses in development and welfare systems and challenges in service delivery around the world. It has also revealed the need for technological innovations in carrying out development activities to ensure safety, effectiveness, and efficiency, particularly at the workplace. We are hopeful that this workshop will enlighten us about the innovations each country is using to deliver family planning services in a COVID-19 challenged environment. Once again, let me thank the young people, government institutions, representatives of traditional and religious networks, civil society organizations, and non-governmental organizations, the private sector, the media, and all other stakeholders who made the time to be on this call and to be part of this year's Family Planning Week celebration. I wish us all fruitful deliberation. Thank you very, very much.
Thank you very much, Mr. Kwame, for those kind words and really reiterating the purpose of this meeting, which is sharing experience on innovative way. We are advancing the family planning in 2020 as we promised in Nairobi. So at this juncture, I would like to call the presenter from Ghana to tell us what they are doing in an innovative way to share experiences for countries to learn on what is happening. And I'm glad to announce that we are joined by more than 130 people from across the Africa region, from Sudan, from Benin, from Kenya, from Ghana, from all over Africa. It's really a pleasure to learning and to listening. So I remind that we have a chat box. Any question, please key it in the chat box. We will address them at the appropriate time. So now I'll call upon our first presenter, Dr. Ya Asante, to tell us in no more than 10 minutes, what is the experience from Ghana? What can we learn from Ghana in doing innovative way of addressing family planning issue? Over to you, Dr. Ya.
Thank you very much, Doctor. My name is Ya Asante from Ghana Health Service. I'm presenting on behalf of the Ghana team. And as you all know, the 1994 ICPD had operations, the ICPD program of action. Next slide, please. So AADP, okay, so I start again. As you all know, the 1994 ICPD in Cairo had our countries were represented, where following deliberations, the ICPD program of action was developed and then adopted by over 170 countries. And then the focus was, empowering women with education to be able to improve expand their access, and then also provide them with health information and services, skill development and employment. And then in 2014, the African Union Summit in Addis Ababa, countries reconfirmed to the declaration of the ICPD. Next slide, please. So in 2018, Ghana had the opportunity to be supported by UNFPA to develop a country program on ICPD plus 25, which highlighted the interventions that the country was undertaking. And I think the document is a public document that can be accessed for people to see what actually the content is. Then in Nairobi, during the Nairobi Summit in November 2019, as we all know, countries made statements and commitments, Ghana included, to be able to improve family planning and SRA generally in our countries. And also the summit, the Nairobi Summit had these 3 transformational goals where countries should commit to. So 0 unmet need for family planning, 0 preventable maternal deaths, and also 0 gender-based violence and harmful practices against women. Next slide, please. So generally, Ghana made these general commitments during the summit. The implementation of the promise of universal access to sexual and reproductive services, and then also to uphold and ensure the fundamental rights of all individuals, also to reap the demographic dividend for sustained socio-economic growth and development, and also to ensure that progress is made in other key sectors of the economy for the overall development of the country. And then importantly, to make sure that there's periodic monitoring of the implementation so that at any given time we know where we are.
We can't hear you. Hello? Dr. Ya, we can't hear you.
Hello?
Yes, yes, you are back.
Hello?
We had lost you for a couple of minutes. Carry on,
Hello?
please. Yes, hello.
Yeah,
We can
yeah.
hear you. Yeah, please proceed.
Okay, okay. So during the Nairobi Summit, Ghana had 9 goals, and now 3 of them were related to family planning. And that's what the purpose for our meeting this morning. The goal 1 was to achieve universal access to sexual and reproductive health as part of universal health coverage by committing to reducing unmet need to 6% by 2030, and also making sure that there is safe, affordable, and quality contraceptives for men, women, and young people who want to use them, and at any time that they want to use them. And then also to improve access to the full range of family planning commodities, services, and information to all vulnerable groups, including people with disability, and also the inclusion of family planning in the health insurance benefit package in the country. And then the second goal related to family planning was mobilize the required financing to finish the ICPD program of action and sustain the gains already made. So with this goal, Ghana is committed to strengthening the mobilization of local resources and allocation, as well as allocation of local resources for the procurement of RH commodities in the country, and also look for innovative ways to increase domestic financing, and also increase official development assistance to complement domestic financing to improve sexual and reproductive health programs in the country. And also at the subnational level to make sure that allocations and financing is available and the regions do not suffer or they are not left on their own. And then the 5th goal was to uphold the right to reproductive. The 3rd goal relating to family planning was goal 5 of vulnerable populations, fragile context. And Ghana is committed to improving access to the full range of RH commodities, services, and information for all internally displaced people in the country, as well as refugees in our country. Next slide, please. So we'll look at some statistics for us to be able to put the discussions into context. For Ghana, the contraceptive prevalence rate for currently married women is 25% as of 2017 by the Ghana Maternal Health Survey report. And during the Nairobi Summit, Ghana committed to increasing it to 44% by 2030. And then for currently married adolescents, Ghana committed to 42.1% by 2017. Next slide, please. Hello. And then for unmet need, currently it stands at 29.9% by the 2014 Ghana Demographic and Health Survey.
Hello.
It to by 2030. And then for currently married adolescents, we 41% by 2030.
We can't hear you, lost you again.
Hello. So
yes.
Okay. This slide is showing trends of family planning use in our country over the years, looking at the various population-based surveys that we've had from 1988 Ghana Demographic and Health Survey, right up to the 2017 Ghana Maternal Health Survey. As you all know, we are interested in the middle line, that's the modern methods. And the increase has been slow, and right now the current rate is 25%. That's where we are now for modern methods. As for any method and traditional methods, we all know they are not cost effective, so we don't bother too much about it, but it's always good to have the comparison for decision making. Next slide, please. Yeah, contraceptive prevalence. This slide, we've tried to compare the CPR between married adolescent women and currently married women. From 2014, the CPR was 22.2% for currently married women, and that of adolescent was 16.7%. And 2017, as you can see, but for 2030, we want to increase it to 44% and 42% for currently married women and adolescents, respectively. Next slide, please.
Quickly, Dr. Ya, time is up. You have 3 more minutes.
Okay. Current use of modern methods by residents. For this slide, we can see that a lot of our women in the rural areas are having access to or are using family planning methods as compared to the urban areas. And one of the strategies that has helped Ghana in this area is the CHIPS, the community-based health planning and services, where community health nurses are available in almost every community, even where there's no physical structure to depict physical, CHIPS compound. The communities have been zoned, and daily community health nurses go into the communities to provide services. And we believe that has contributed to us having, being able to improve access to family planning in our rural areas compared to the urban areas. For the urban areas, we have a lot of urban areas whose conditions are very poor and they don't have access to a lot of services, including family planning services. And we believe that is also contributing to the low coverage in the urban areas. Even though they are in urban areas, their access to almost everything is very poor. Next slide, please. Yeah, unmet needs compared. Next slide. It's not different from what I showed. Then the trends in total fertility rate over the years, as you can see, has been coming down, but I think, as you can all see, we can do better. Now it stands at 3.9 as of 2017 end. we believe we can do better, putting more effort and resources. Next slide. Then achievements, recommendations, and way forward. So the increase in the CPR, as I said, is 25% from a very low figure where we are now. And we are also seeing similar trends in the married female adolescents. Next slide. Next slide, please. So in this country, we have the slide before this one, please. Okay, the presence of an agency mandated to handle issues on family planning. We have the Ministry of Health, we have the Ghana Health Service. The Ghana Health Service is the largest provider of healthcare in this country, including RH services, and that's the mandate. And then we have the Interagency Coordinating Committee for Contraceptive Security, which has been in existence since 2002, a very active and vibrant committee that meets every quarter, takes decisions on family planning regarding procurement and all the issues about family planning. It's a multi-sectoral, the private sector, public sector, CSOs, NGOs, everybody is there. And that has really helped us move family planning activities in this country. And then the policy environment in this country is very favorable.
Hello? Hello, can you kindly try to sum up in the next minutes?
One of our policies kicks against the use of, we think that we have a very legal environment, like I said earlier. Now we have, so if a woman is registered and is paying premium, she goes to the facility and she doesn't pay for any service as far as family planning is concerned. The collaboration between the public sector, the private sector, now all our partners are fast as far as family planning is concerned. We've also gone into task sharing where community health nurses are providing the long-term method, that's the implants. Initially, it was only doctors and midwives who were allowed to provide implant services in this country. But the policy was changed in 2012, and now we have the task sharing, they are providing services for us. And like I said earlier, there are many and they are the most widely distributed health services, health workers in this country, found in almost every community. They are there providing the services for us. And then advocacy and communication to promote FP among people living with disability. This is a very weak area for us, but efforts are being made to be able to reach them as much as possible. We've been supported by UNFPA to train resource persons and then some service providers so that they know how to provide services to SRH services to people with disability. Men have been trained, religious leaders have been sensitized to talk about family planning whenever they have the platform to do so. Next slide, please.
Conclusion, please. Thank you so much.
Next slide. Some of our challenges. The gap between knowledge and use of family planning in this country is very sad. The knowledge is almost universal, but it doesn't translate into use, as you can see. With the knowledge of 99%, it's only 25% who are using the family planning methods in this country. Next slide, please. So for services, we have the social, cultural,
Hello, Dr. Ya, I think I lost you again and time is really up. I think we need to stop here and probably get another opportunity to elaborate more on the remaining slides.
Family planning in this country, and all that, not people with disability.
Hello, Dr. Ya. Thank you so much for the presentation, and we'll give you opportunity to elaborate more on the
and then the issues, we have issues with the COVID-19. Okay, thank you.
Thank you very much. And thanks a lot. We look forward. We'll share the presentation with all of the participants for us to be able to engage and to read more, to know what is happening in Ghana. But we really appreciate the presentation, the steps which are taken, and we note the challenges which are yet to be encountered, not to encounter, but to overcome. And together in partnership, we'll work towards reaching the target that we set in Nairobi. So with all the knowledges that we've acquired, I think it is now time to take a short break to test our own knowledge of family planning. We kept on talking of family planning, but let's see how conversant we are with family planning. As we take this short break, I will encourage you all to read the questions and participate in it to see how we are doing and how fun it is. So I will call, before we go into the questions, I will call for a short video. Sorry. Maybe, yeah, let's go to the question and see how we are doing in family planning, and then we'll listen to the video and then we move on to it. So we have a poll question. And, hello, can you hear me? Okay, thank you so much, Dr. Ya. We have a question here and we invite every participant to contribute and to participate. It's a simple question to see how well we are conversant. We've been listening to family planning from the opening statements to the presentations on specific countries like Ghana. So the question says, I give you double protection. Who am I? Emergency contraceptive, IUD, condom, implants. You are called all to go on your screen, computer, laptop, and choose any response which is adequate to the question, and then you click on submit. We'll see how we are doing. So let's all get to it and see our poll and our knowledge of the questions and family planning. Over. Let's start, please. It's just a click and you submit, that's it. Can we please cast our votes, choose our responses? Right there on your screen for all the presenters. Kindly pick one and submit. Hello? I give you double protection. Who am I? You have to choose between emergency contraceptive, IUD, condom, implant, and then you click on submit. You can choose either this, that one, this, or that, and then you click on submit, and the responses will be displayed. Let's do it. Thank you, Marvis. I see that you've submitted. You responded, and click on submit as well, please. Have we all done it? Thank you very much. As you can see, 91% of the respondents reported that condom is the one that gives you double protection, while 3% said emergency contraceptive can give you double protection. And 3% again said that IUD can give you double protection. 3% again said implants can give you double protection. The real answer is that condom is the one that can give you double protection. It can protect you from the STI. It can protect you from HIV. It can protect you for pregnancy. It can protect you from unwanted pregnancy. So the double protection, we can only get it from the condom and not other methods. Thank you so much. And let's move to the next to see a short commercial break with what is happening. What did the leaders commit when they were in Nairobi? We matched different dignitaries from the 179 countries marched to cast their wish and their vision on the ICPD mandates and where to accelerate, and what is the unfinished business. Let's see what Gambia told us on the unfinished business. What did they march for? Let's hear it.
I marched for the 2 among 3 Gambian women who are victims of sexual and gender-based violence.
I marched for the Gambian woman living with obstetric fistula, isolated by her community for suffering a childbirth injury she never asked for. The woman whose chances of regaining her health, dignity, and confidence are very slim.
I march for all those women and girls who cannot participate in any community development activity due to low self-esteem resulting from continuous violation of their rights.
As the Gambia heads to Nairobi Summit in November, I march for those women who lose their lives while giving birth, for the women who live in the remotest areas of the country, whose access to skilled delivery is limited.
I march to show our commitment to ensuring Gambian women everywhere live fistula-free lives and enjoy the best attainable state of physical and mental health.
I march for all those women and girls whose rights are violated and yet they continue to suffer in silence.
I march for every Gambian woman who experiences gender-based violence. I march for every Gambian woman whose family planning needs are yet to be met.
I march to ensure that women are empowered to speak out so that collectively households and communities protect the rights of women and girls.
As we head to Nairobi to renew our commitment to deliver for key populations, I march.
In preparation for the Nairobi Summit, every day I live and work to ensure that sexual and gender-based violence becomes a thing of the past. This is why I march.
I march.
This is why I march.
Thank you very much. And on this juncture, I will call upon the Gambia to tell us if the march on gender equality, on the different aspects that the dignitary from the Gambia country had marched for in Nairobi, how are they putting them in place? How are they implementing it? What are the innovative strategies they are using to implement it? I welcome Mr. Jibril to give us the presentation for Gambia. And please, you have 10 minutes for the presentation. If you could kindly be brief and straight to the points so that we learn on what is happening in the Gambia. The floor is yours and you are most welcome, sir. Mr. Jibril, please.
Thank you very much,
Okay.
moderator. I'm trying to share my screen.
Are you sharing your screen? We can't see it.
Yeah, I'm trying to. It's giving me some difficulties. Can the IT share my presentation?
Did you share it?
Yeah.
Okay. If you shared it, then he'll be able to help you. Mr. Adare, do you have the presentation? If you can kindly share it.
Please share your presentation by email. We don't have it.
Oh, okay. All right, I'm forwarding it now then.
Okay, thanks.
Maybe in the meantime, as you are looking into the presentation, we have a question in the chat box on family planning for the presenter, Dr. Ya. Is family planning only about birth control? If you can kindly respond briefly to that as we prepare for the presentation of Mr. Jibril. Dr. Ya, you have the floor.
No, family planning is not about birth control. It's about empowerment. People having the freedom to decide freely when to have their children, the number to have their children, the time to have their children. So it's not about getting people to stop giving birth, but to help them to
Yeah, thank you so much. Your connection, your line is breaking, but the response, the one who asked for the question, I think that's family
the way
planning.
they want to have their children.
Yeah, it's not just about,
Unfortunately,
it's not about birth control,
community
but
members.
making
So people
freely.
think about children.
Yeah.
It's not really about them, need them, the number they want them, so that they can go on with other things apart from.
Thank you so much. So whoever asked the question, family planning is not about birth control, but it's about empowerment and making an informed choice of how many children you want to have, when do you want to have them, what is the spacing that you want. It's a development issue, it's not a birth control. Thank you so much. Do we have the presentation now?
Della, check your email.
And there are great responses as well and contribution from the chat box that family planning reduces infant mortality, it helps preventing HIV and AIDS, it empowers people and enhance education, which are all contributing factors of the developments.
Della, check your email.
I've checked the email, it hasn't dropped yet. I'm in my email now.
Oh, all right, I've already sent it.
Okay, it's come now. Now I see it.
Thank you very, very much. Mr. Jibril, you have the floor.
Yeah, thank you very much, Dr. Anis, and thank you, colleagues from Ghana and the earlier presenters. This is very important that we have this conversation going on. And due to the limited time, but probably we will get into the question and answer session where we will deal more on issues out of the presentation. I am Jibril Jaju, the Director of Planning and Information, and the Health System Strengthening Coordinator, and also the focal person for FP 2020. Yeah. So when we look at in brief, the Gambia commitment in relation to ICPD, what we committed as a nation was to create a budget line. One was to create a budget line for FP commodities and services in the national budget by 2020. And also to train over 500 people, basically clinical service providers to provide long-term contraceptive methods at all levels of the healthcare service delivery system before 2024, and also ensures that uninterrupted supply of contraceptives from 17 to 0, and ensure no FP commodity stock out by 2021. And also operational research on possible introduction of new contraceptive methods applicable for use in the country, and also strengthening advocacy, communication, and behavioral change for increased uptake of FP and sexual reproductive health services among men by 2024. These are the commitments that the country has made, in relation to the ICPD. Under the strategies and innovation to achieve the target under the service delivery, the Gambia Ministry of Health, aims at providing equitable access to family planning services for contraception and management of infertility and subfertility across the country under information and education and communication. Section, we are to provide accurate information communicated in a culturally and religiously acceptable manner to raise awareness of family planning and its benefits. We all know that religion plays a crucial role, in this part of the world in accepting, in accepting health interventions. FP being a very, important intervention, we have to make sure that the communication that we send out are culturally accepted and also religiously, accepted as well. So the other area of the component in terms of innovation is the strengthening of the community-based distribution services to reach hard to, in other words, how do we make sure that we decentralize the distribution of FP commodities, and also the provision of incentives for community-based distributors in the form of hand milling machines to minimize the hard attrition rate. Some of these people who participate in the distribution of these commodities are doing it voluntarily. So this is part of the commitment that we want to do innovatively, so that they will stay in the trade and they will not leave, because they have an additional source of income, so they will continue providing this type of services. And under commodity security, we are saying that regular uninterrupted supply of high quality commodity, including newer technologies at all service delivery points. So later on, you will see that in terms of the FP commodities and in terms of the service readiness and availability, we are high up in relation to the commitment that we have made. Under the leadership and governance is to make sure we have an enabling environment for family planning interventions with leadership and coordination by government through the Ministry of Health. So on the financing is the realistic allocation of funds by government with support from the development partners and mobilization of financial and other resources from the private sector. This component is very important. In fact, currently the Ministry of Health has started the implementation of a very important project, which is the Gambia Essential Healthcare Project. And family planning is one of the key components of the project. In fact, it's one of the key targets, because our fertility, as you will see later on, is average 4.4, which is actually high. So there is, a commitment in terms of government investment to the family planning, section. Next slide. So in terms of the challenges for the commitment, we still have cultural and religious barriers and misconception about family planning affecting the uptake of services. We still have the association of contraception with, because the Gambia, we all know, as a developing country, women feel very shy to go openly to healthcare providers to ask for contraception. Talk less of men. Men, we will actually feel shy to go to the facility. but they will go to the pharmacy to buy, but they will not go to the village health facility to request for condom. So these are some of the cultural and religious issues that are affecting our FP 2020 commitment, and a poor understanding of the consultative method resulting in fear of long-term effects, is also another issue we are facing in terms of challenges, and also desire for the large families to support farming activities, or due to competition among co-wives in polygamous setting. Gambia as a country, polygamy is is very plenty. We have a lot of people, going in for polygamous marriage. So this type of marriages, introduce competition between, women who should have more kids. So it's also a problem, because we have over 95% of the population are Muslims, and they believe in polygamous marriage. And shortage of qualified health service providers. This is very, 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 very crucial. And the government, as you can see in the commitment, we are definitely interested in providing over 500, to build the capacity of over 500 healthcare workers to be able to provide, this very important service. But it's still a challenge, as we all know, the intrusion of the private sector around West Africa in terms of healthcare service delivery is increasing, and government need to match the bill of the private sector by motivating its staff for them to be able to stay within the public sector. And the misconception of family planning being against the religious doctrine is also a challenge. Some scholars will preach against family planning. We all know, some of our Islamic scholars will preach against family planning and then, associated with evil. So those are some of the challenges, and then,
2 more minutes, Jibril.
Yeah, so some of the issues also is the opposition from men who are the key decision makers in the homes. This is why our interest is to make sure that we build the capacity of women to know that the decision is up to them to take, whether to have a child or not. Yeah, next slide. Yeah, so these are some of the lessons we've learned. Low uptake of family planning in the country is contributing to the high maternal and infant mortality rate. Maybe during the question and answer session, currently there is a high, debate around maternal mortality in the country. Although it's sad, no woman should die during childbirth, but however, we are experiencing, an unusual trend, and women have taken to the street to demonstrate that their life matters. So we believe that family planning can actually reduce, maternal mortality, and it is evident all over the world that family planning can actually reduce maternal mortality. Yeah. So let's move on to the next slide. This is a slide that I wanted to compare, the COVID, the issues around the pandemic response. We've seen, and I'm sure all over the world, services are interrupted. And in the Gambia too, based on the analysis we have for 2019 and 2020, Q1 alone, I'm sure the figures will be even worsened in Q2. We have a drop of over 2,000 people, new acceptors compared to 2019. The new acceptors has gone down, by around 2,000, people. Let's move on. When you look at this chart, will tell you that in terms of percentages for family planning services for Q1 and Q1 2019 and Q1 2020, we realize that the services have gone down in 2020 due to pandemic, due to the coronavirus. So which is alarming, and as a ministry, we are very much concerned that this figure should actually be the other way around, but we are concerned that a lot of people are staying at home, and FP services continue to go down. And these are some of the services provided: the depot, the condom, the Jadel, the ICE, IUC, and the other component. You realize that the figures are far much better in 2019 Q1 than 2020 Q1. Yeah. So next slide. Yeah. So as I was saying earlier, you've seen that the total fertility rate of Gambia is 4.4, and rural versus urban, and it is high in urban in urban area, and adolescent birth rate is around 65. Between the women between the ages of 15 and 19, which is actually very high. So this will, no wonder the rise in maternal mortality recently. But it's a concern that we have to improve on our FP services to be able to actually improve in terms of the prevalence. However, the prevalence we have improved, compared to the 2013. We are around 27.8 now in terms of our contraceptive prevalence. That is as of 2019. Let's move on to the next slide. So this also, in terms of the readiness to provide this service, we realize that in terms of readiness, our public health facilities are almost above, in terms of medicine and commodities, are almost above 90. In terms of the readiness to be able to provide services for maternal, neonatal, child, and adolescent health. In terms of the commodities, we are above almost 19. And in terms of equipment, also we are almost 19. And the overall rating in terms of readiness is almost 80, above 80. But staff is only 60%. So these are some of the challenges we are facing as a country, in the response to promote the usage of FP FP services. Yeah. Last but not the least slide is the way forward for the agenda, FP 2020 agenda. One crucial issue is the conduct of the core technical committee meetings regularly to be able to know the challenges in terms of FP service provision, what are the bottlenecks and how do we remove the bottlenecks so that the services will be available to whosoever needs it, and also partner mapping and other FP stakeholders in country to be identified and engaged. These are the way forward that the focal person office want to actually implement in relation to the Gambia commitment to FP 2020. So last but not the least is the issues around the Gambia budgetary commitment. As I said earlier, we were not having a specific budget line for family planning services, but we've now introduced a specific budget line that will target specifically family planning interventions in the country. And as I said, a project is starting soon, which has one of the key performance indicators on family planning. One of the key performance indicators is on family planning. So as a country, we are actually pushing very hard to make sure that family planning is on the agenda. And we've recently validated our essential healthcare package, which also take into consideration family planning across the different level of service provision in the Gambia. On that note, I want to take this opportunity to thank you, Dr. Anes, for the good moderation, and hope to receive questions and comments, later on as we move on. Thank you. Over to you.
Thank you so much, Mr. Jibril. Plenty questions, of course, will be coming, and we'll be glad to hear from you again how you are addressing them. And I would like to announce that due to technical challenges, we were unable to be joined by our panelists from Kenya. So we will manage the time with the presentations that we have. But at this time, let's look into the second poll and see how we are doing as an icebreaker. Mr. Dare, please, next poll. The question is up there. Exclusive breastfeeding is also a family planning method. True or false? What is your take? What is your response? Please vote and submit. Exclusive breastfeeding is also a family planning method. True or false? Submit your response. "30 seconds to go. There we go. Thank you so much. As you can see from the responses, 75% agrees that exclusive breastfeeding is also a family planning method, while 25% says no, it's false. The response is that exclusive breastfeeding is also a family planning method. Well done, team, and let's keep educating ourselves. And let me invite at this juncture our presenter from Bénin, Dr. Gaston Aounou, vous êtes le bienvenu pour nous présenter et vous avez exactement 10 minutes. If you can kindly be brief and concise. Merci beaucoup, docteur, vous êtes le bienvenu.
Okay, thank you very much, Chair. My presentation is in French, in English, but I try to speak French. Donc, comme je le disais, merci beaucoup. Ma présentation est en anglais, mais je vais parler français. J'espère qu'on m'entend. Comme le Bénin, comme les autres pays, avait pris des engagements au sommet de Nairobi sur la conférence internationale sur la population, sur la planification familiale, sur la population et le développement qui a eu lieu à Nairobi l'année dernière. Et les engagements pris par le Bénin, comme pour les autres pays, se résument, comme vous le voyez, présenté sur le tableau. Donc, le premier engagement, il y a 5 engagements pris par le Bénin, et dont les 3 premiers que tout le monde connaît, c'est mettre fin aux besoins non satisfaits en matière de planification familiale, mettre fin au décès évitable chez la mère et mettre fin à la violence basée sur le genre et aux pratiques néfastes. Les 2 autres engagements sont des voies et moyens pour réussir les 3 premiers. C'est réduire d'ici à 2030 la mortalité maternelle de 335 décès maternels à moins de 200 décès maternels pour 100 000 naissances vivantes au Bénin, et de prévenir les grossesses non désirées et les avortements, notamment en fournissant un accès universel à la planification familiale, y compris avec des stratégies innovantes. Voilà ce que le Bénin avait retenu au sommet de Nairobi comme engagement et que nous essayons de faire. Qu'est-ce qui a été fait depuis ce sommet-là? Je vais présenter ici, slide, please. Quelques résultats de ce qui a été mis en place depuis le sommet. Et il faudrait reconnaître que l'évaluation du niveau d'atteinte de ces engagements est présentement en cours en atelier national par la Commission nationale de la population à travers son comité technique. Donc, cet atelier est en cours pour pouvoir évaluer le niveau d'atteinte des engagements. Mais des résultats, nous connaissons déjà que certains engagements, il y a eu des résultats quand même qui sont atteints. C'est l'engagement de la partie nationale pour augmenter les ressources pour l'achat des produits contraceptifs qui doit être autour de 250 millions. C'est la prise de textes de loi définissant les quotas de représentativité des femmes dans les instances nationales et dans les instances locales. C'est la mise en place du volet santé de l'assurance maladie universelle avec la mise en place d'une agence nationale pour les soins de santé primaire. C'est la mise à l'échelle aussi de l'éducation à la santé sexuelle dans les établissements scolaires et l'intégration des différents volets de santé de la reproduction en milieu scolaire. C'est la mobilisation des ressources pour la continuité des services intégrés du SMINEA. Je pense que mes résultats ont été sautés, et la présentation. Il y a eu aussi quelques autres résultats, comme la relecture de la politique nationale de la jeunesse pour intensifier l'engagement des jeunes en ce qui concerne les droits en SR. C'était la dia précédente. Hein?
Previous slide, please.
Non.
The previous
dans l'autre
one.
sens. Il a ce voilà, c'est ça. La mobilisation des ressources pour la continuité des services de PF. Il y a l'intégration de la gestion des produits de PF dans la direction de la logistique de la nouvelle agence, le renforcement de l'intégration des services de PF et des services de SONU, le renforcement des leaders religieux pour la PF à travers leur plateforme, ce n'est pas écrit sur le slide, le renforcement du système de santé pour assurer la disponibilité des services de produits jusqu'au dernier kilomètre. Slide, please. Maintenant, je vais vous présenter quelques résultats que nous avons obtenus à travers l'intégration de la méthode, d'une méthode qui permet l'autonomie des femmes en matière de planification familiale. Je veux parler du DMPA sous-cutané que le Bénin a introduit depuis quelques années et on a dû faire une comparaison par rapport à la formation et l'offre des services et l'utilisation de cette méthode-là qui permet d'autonomiser les femmes dans l'utilisation des services de planification familiale. Comme vous le voyez, au troisième trimestre 2019, on avait formé beaucoup de prestataires et lorsqu'on est passé à l'échelle, la formation a continué jusqu'au troisième trimestre de l'année 20 en cours. Slide, please. Il y a eu la couverture du pays par rapport au DMPA sous-cutané, comme c'est bientôt la couverture intégrale dans tout le pays. Il ne reste que 4 zones sanitaires, 4 districts sanitaires sur les 34 que compte le pays pour avoir une couverture intégrale. Je dois dire que cette méthode qui permet de faire la promotion de l'auto-soin, surtout en période de pandémie du coronavirus que nous connaissons maintenant, a permis d'avoir quand même des résultats comparatifs que nous allons montrer tout à l'heure par rapport à l'utilisation des services avant la pandémie, pendant la pandémie et maintenant en cours après la pandémie du coronavirus. Dia.
Next slide.
Next. Donc, vous avez vu, de manière globale, je présente l'utilisation en termes de chiffres absolus des services et des méthodes contraceptives de janvier à juillet 2020 pour montrer que malgré la pandémie, nous avons quand même une utilisation bien prononcée, surtout pour cette méthode qui fait la promotion de l'auto-soin et pour les méthodes de PF de manière générale. Donc, en janvier, on était à 21 000, disons 22 000 utilisatrices et en avril, en mars, en plein cœur de l'épidémie, on est passé même à 31 823 utilisatrices. En avril, c'est descendu un peu. C'était la période de confinement au Bénin où le déplacement, le cordon sanitaire, disons, où le déplacement était limité. On est tombé néanmoins à 19 000 utilisatrices pour remonter la pente et depuis le mois de juin. Slide. Lorsqu'on regarde l'utilisation de l'ensemble des méthodes contraceptives par rapport au DMPA sous-cutané, vous avez vu que le DMPA aussi a la même tendance d'utilisation, sauf un mois de juin où c'est un peu moins utilisé par rapport aux autres mois. Et vous voyez que le mois de juillet est comparatif par rapport, l'utilisation a commencé par reprendre, bien que la pandémie continue pas à être en cours. Il est bien vrai, le compteur sanitaire en temps avait été levé. Tiens. Donc, de manière globale, Madame la Présidente, on peut dire que depuis le sommet de Nairobi en novembre 2019, des actions ont été prises pour répondre aux engagements pris par le Bénin. Mais l'évaluation est maintenant en cours. Il est bien vrai que pour nous édifier sur le niveau d'atteinte de ces engagements-là, il est bien vrai que tous les engagements ne sont pas pris, mais des actions sont menées dans ce sens pour que nous puissions atteindre nos engagements qu'on avait obtenus. Slide. Je vous remercie. Thank you very much for your attention.
Thank you very much. Merci beaucoup, Dr. Gaston. Vous avez bien utilisé le temps qui vous est imparti. Nous vous remercions infiniment.
Merci.
So, colleagues, I'm sure you were able to read the slides for the non-French speaking people, or if you are not able to, it summarizes on the key commitments, 5 commitments that the country Benin made in Nairobi. There were around 5 commitments, and which are being implemented in different angles, and they are yet to assess the evaluation, to make an evaluation to see how far they've gone. But it has seen a slight progress of what they've committed. And despite the COVID, family planning uptake continues to rise and went down during the lockdown period and also picked it up. So it's good to hear and to learn that improvement is being made and achievements are being taken seriously. So looking forward to the results of the assessment to see how Benin is doing vis-a-vis the commitments made in Nairobi. Let's move to the last poll before we start the discussion and the questions. We have plenty of the questions which are being posted on the chat box. Some of them are being responded to, and I thank all people who are shedding light on it, and we'll take more questions or we'll respond to some other specific questions by the panelists. But before we do that, let's go to our last question on the poll to select the most appropriate answer. Family planning methods for men are oral pills and condom, implants, condom and vasectomy, condom and vasectomy, all the above. I repeat the question. Select the most appropriate answer. The family planning methods for men are oral pills and condom, implants, condom and vasectomy, condom and vasectomy. All the above are correct. Please cast your votes and let's see the responses as they come in. You have 30 seconds to place the button and to push it to submit. Thank you. Great, we have our responses. As you can see it, we have 89% of the responses. Let me start with the lowest. 1% think that all the above are family planning methods for men. And we have 3% who think that implants, condom, and vasectomy are family planning method for men. And there are 7% who think that oral pills and condom are family planning methods for men. The correct answer is that family planning method for men are condom and vasectomy. It's not because it's voted by 89%, but because it is the truth. Oral pills are for women, implants, condom are for women, but vasectomy and condom are for men. Thank you so much for casting your votes. And now I will read some specific questions. We are now to the session of questions and answers. Our panelists, I would like to really thank you for your contributions and all the presentation, brilliant presentation that you've made. All of these will be shared with all the participants for them to appreciate it. We have a couple of questions, but for the sake of time, we will manage a few questions, and I'm sure and can see that the chat box is full of responses, good responses from the experts who are attending the meeting and who are responding and addressing to it. Let me put the first question to Gambia. Gambia, there is a question saying that Indonesia is most populous Muslim country, and yet family planning uptake in the country is very high there. What lessons can Gambia learn from Indonesia? That's from Gambia. And the second question, which Dr. Ya would want to reflect on, is to shed more light on how breastfeeding is a form of family planning. Remember our poll, we had exclusive breastfeeding as a family planning method, but there's a question to shed more light on how is it a family planning method. For Benin, nous avons une question. We have a question, I hope you understand English. How did government demonstrate its commitment to family planning? If you can kindly shed light on how the government of Benin demonstrated its commitment to family planning, and also how the DMPA was available in the regions shaded in the green. So the floor is open. Let's hear first from Gambia, then Ghana and Benin. Thank you.
Yeah, thank you, Doctor, for that brilliant. Yeah, it is always said that especially in Gambia, as I said earlier, you have religious scholars who actually also promote family planning and who also advocate for family planning. But you also have, religious scholars who also, preach against family planning. And it is true that the Gambia can actually learn from Indonesia in relation to the intake. But the interesting part of the Gambia is, the literacy level. The literacy level is low, actually, it's low. So for that being the case, it will be very difficult to actually promote family planning in a community that actually sees the benefits of having more kids in relation to family. So that's the problem about the Gambia. But however, it is true that we can also learn what Indonesia is actually doing to be able to sell family planning services. For the Gambia now, what we are doing now with the help of UNFPA is to target religious leaders, to educate them, to understand that family planning has nothing to do with Islam. It's about the right of a mother to have kids or not to have kids, and it's about the health and well-being of the woman. So these are some of the strategies we are now trying to implement, and also creating women empowerment projects that will actually provide additional income to women and make them more engaged, so that they will not see having children as an option to having wealth. So these are some of the issues we have. But it's important that we also, I agree, learn from Indonesia what they are doing right. But you realize that our prevalence is steadily going up based on the few interventions I have also mentioned during my presentation and now as well. Yeah, thank you very much.
Thank you very much, Jibril. Dr. Ya, if you can kindly shed light on the exclusive breastfeeding as a family planning method. Yeah, are you still online? I think she has a connection issue. Maybe we can move to Benin to tell us how the government demonstrated its commitment to family planning, and also let us know if the shaded green parts in the presentation that you had, if it represents the EMPC SC in the region which was shaded in green. Vous avez la parole, Dr. Gaston Aouno, pour les deux questions.
Thank you very much. Merci beaucoup pour la question. Merci pour ceux qui ont posé aussi la question. Merci, Madame la Présidente. Je pense que le gouvernement a assez démontré son engagement en matière de PF à travers le respect de l'engagement qu'il avait pris d'atteindre au moins 250 millions de francs CFA pour l'achat des produits contraceptifs. Il est bien vrai que cet engagement avait déjà été pris depuis le sommet de Londres sur la planification familiale de 2017, puisque c'était un renouvellement de l'engagement qui avait été pris depuis 2013. Mais après le sommet, cette année et l'année dernière, cet engagement a été atteint pour l'achat des produits contraceptifs. Nous avons atteint les 250 millions. Maintenant, c'est de respecter une autre partie de l'engagement qu'on avait pris, d'augmenter la part du gouvernement pour l'achat des produits contraceptifs de 10% chaque année par rapport au niveau antérieur. Par ailleurs, un autre domaine d'intervention est que nous sommes en train de tout mettre en œuvre pour que la planification familiale soit prise en compte dans le cadre de l'assurance du volet santé, de l'assurance pour le renforcement du capital humain, l'ARCH qui est en train d'être mise en place en phase pilote. Et nous pensons quand même que cet engagement sera aussi retenu et cela démontre fort bien l'engagement du gouvernement pour la planification familiale. Par rapport à la deuxième question, si j'ai bien compris, en fait, la carte montre l'atteinte, les districts sanitaires qui sont couverts par le DMPA sous-cutané. Donc, c'est presque sur les 34 districts sanitaires, il ne reste que 4 districts sanitaires non couverts. Dans le vert, ça montre les zones où le DMPA sous-cutané est déjà présent. Donc, il reste, le blanc, c'est les zones qui restent à couvrir très rapidement et nous pensons le faire très rapidement pour la couverture intégrale. Maintenant, il restera l'auto-injection, self-injection, que nous allons démarrer très bientôt et nous allons aussi nous pensons aussi pouvoir couvrir tout le territoire par rapport à ça. Je pense que j'ai répondu aux 2 questions qui m'ont été posées. Merci, Madame la Présidente.
Merci beaucoup, merci infiniment. Thank you so much. He has responded to the questions which were asked on how the governments really managed to keep the commitments. And he shed light on few examples or concrete commitments which were made by the government of Benin. One of which was to increase or to commit its contribution to procuring commodities up to 150 million CFA currency to procure the commodities. This was a commitment that they made, but following the Nairobi since 2 years ago, they are now honoring this commitment on procuring them on a yearly regular basis up to 150 million of their currency. The government also in providing or implementing its commitments, they have committed and they have now starts increasing their contribution to family planning 10% each year. So for instance, if we were in 2020 and they procured family planning for next amount, next year they will increase it to 10%. The following year, they will increase the previous year with 10%. So they are honoring it by adding up and topping up 10% increase in family planning each year. And also another aspect or something which is done in Benin is that family planning is being considered as part of the health insurance scheme so that women and men are can easily access family planning services using their health insurance. On the second questions, yes, indeed, the shaded green indicates regions where the DMPA SC is reflected and covered. And among 34 regions, only 4 are not covered, those which were shaded in white, while the 30 are all covered and why they were shaded in green. They are yet to implement the self-injected plan, which is also part of their commitment, and they are on course of doing it. So those are the responses to the colleague. And to the one who asked the question, I hope you are clear with all of those. Thank you so much. Do we have Dr. Ya back? Can you hear us? I think we lost her, but we have plenty responses regarding that, and you can read the chat box. You can keep posting your questions and we'll hear responses to the questions that you've reduced. I see that Della has provided responses to the exclusive breastfeeding. The response says that evidence is demonstrating that when you exclusively breastfeed, it means nursing at least every 4 hours during the day and every 6 hours at night, and feed your baby only breast milk. Only breast milk. Your body naturally stops ovulating. You can't get pregnant if you don't ovulate. And also, Dr. Letitia, who posted the response as well, that exclusive breastfeeding acts like the hormonal contraceptive pill. Thank you for all your contributions and to responding to all the questions. Now we are approaching the end of our session. I would like to really thank and commend all the presenters, all the speakers, all the participants from all over the region who contributed with their ideas, the questions, and the presentations. As we conclude,
my hand has been up.
Hello?
My hand has been up. Raise my hand. You didn't call me.
Oh, sorry, I did not see it. Go on, Dr. Letitia.
Yeah, thank you so much for the opportunity. I just have a comment to make. You know, during Dr. Asante's brilliant presentation, there was an information there that knowledge of family planning is 99%, 99%. But then when you had your quiz, for the first question, we had 91% of us know the answer. And for the second question about the benefits of breastfeeding, we had a whopping 25% of us not knowing the correct answer. And then for the third question, you have 11% getting the wrong answer. You know, Doc, I have always had the impression that the education about family planning is not very adequate. And this research you have done, for me, confirms it. And so I think we really need to look at the education on family planning. Even amongst these selected people, we haven't these figures. But then in our data, we have 99%. So we have to look at that very critically, look at our data and let it inform what we do. And education on family planning, I think, is very, very important. And the exercise you did was so excellent. It just showed that there is still a gap. Thank you.
Thank you so much, Dr. Letitia, and rightly so. We still have a long way to go. We still have a long way to educate, and the education has no border. Whether you are educated, an educated person or none, whether you are rural or urban, we still all need to get it right and to educate more on family planning and get it right and using the services available. So as we conclude, I would like to give an opportunity to our panelists. I know I've pressurized them because of the time, but just giving them a 1 minute to give us a takeaway message, and we will invite our partner to give us a vote of thanks. But before he does that, I will call upon our different panelists from Gambia and from Benin. And if we have the Ghana one takeaway message for the audience, please. Gambia, you have the floor.
Yeah, thank you very much, Dr. Dr. Evil, moderator. Thank you very much for giving me the opportunity to share our Gambia experience. One thing we need to actually understand or to actually take along is family planning is a key determinant to development. Family planning is a key determinant to development. And family planning is also a key determinant to the reduction of maternal mortality. So as a country, the Gambia, grappling with high maternal mortality, you know, for us to be able to reduce the trend, we have to actually promote aggressively the use of family planning services within our public health sector.
Thank you very, very much.
I have.
Thank you very much, Jibril, for the message on takeaway. Family planning is a key determinant of the development and plays a critical role in reducing maternal mortality. Dr. Gaston, a takeaway message, please.
Oui, merci beaucoup. Je tiens d'abord à remercier les organisateurs de cet échange-là. Merci, cela permet de galvaniser les autres à avancer, de nous galvaniser aussi à respecter nos engagements. C'est vraiment très important d'avoir associé tous les pays de la sous-région et d'avoir associé le Bénin à cet échange. Je tiens aussi à dire que nous devons tout faire au niveau de nos différents pays pour respecter les engagements que nous avons pris. Et ces échanges permettent effectivement d'atteindre ces objectifs-là, puisque nous savons que la planification familiale, comme moi je le dis souvent, parce que c'est le premier pilier pour la réduction de la mortalité maternelle et infantile. Et nous devrons investir là-dedans, investir non seulement financièrement, mais nous investir et physiquement et matériellement pour que nous puissions atteindre les objectifs qui nous sont assignés. Merci beaucoup. Merci à tout le monde pour l'échange.
Merci. Merci infiniment. His takeaway message is that we keep our promise on the commitments and we implement them as they are. And also investing in family planning remains critical, not only financially, but we have to invest in it with our entire body, mind, and spirit and soul, thinking of it, investing in it financially, investing in it in our development plans, but putting it at the center of the development. He's appreciative of this opportunity and experience sharing, which is lightening and giving lessons to countries to learn from. A takeaway message from Ghana. Dr. Ya, I think she's having a challenge to joining. The connection is not good, but I think we've heard also Dr. Letitia, who shed light on several, and would like really to appreciate and to commend all of you. And now at this juncture, I would like to invite Mr. Adams from Planned Parenthood Association, PPAG Ghana, to give us a vote of thanks. And for me, I would appreciate, I thank you all for your kind attention. And for the 2 hours that we spent together, it has been a brilliant experience, sharing and rich information from all the angles. So, Mr. Adams, you have the floor to give us a vote of thanks.
All right, thank you so much, Agnes. And I want to say thank you on behalf of all the members of the organizing team to the 130 participants from all the countries, Ghana, Gambia, Benin, and then the other countries that have joined. We also want to say a big thank you to UNPA, National Development Planning Commission, the National Population Council, Ghana Health Service, and then the PPAG, Planned Parenthood Association of Ghana, for putting this together. And we also want to say a big thank you to you, Agnes. You have done a yeoman's job, and we'll put our hands together for you. We want to encourage everyone to continue the conversation and the discussion, influencing policies at our various countries to make sure that family planning is accessible, it's affordable, and it's available to everyone. Thank you so much.
Thank you so much. Goodbye, have a blessed day, and have a good day too. Thank you all.
Thank you.
Thank you, Mr. Gabriel and Dr. Ahunu.
Yeah, thank you.
And Mr. Ojo Alape. And Dr. Apia.
Thank you.
Ciao.
Thank you, Dela. Thank you very much.
Thank you, Agnes.
Thank you.
Thank you. Yeah.
Bye-bye.
Bye. You're holding. COVID is going